What I've seen recently is people coming in and saying, well, I have insurance. And the first question I ask them is, what's your out of pocket deductible? What do you have to pay before your insurance kicks in? As of late, people are paying up to $25,000 before their insurance kicks in. Do you understand you could then see me for 100 visits or more if you pay me $250 for a visit?
Hi, I'm Susie Rains, founder of the Centered Care Directory and host of the Health Over Wealth channel. With decades of experience in healthcare, I know firsthand how challenging it can be to find a practitioner who actually has time for you. Today, I'm sitting down with Chad Stencel, family nurse practitioner in Minnesota. And he does something in his practice that most practitioners aren't offering yet. I'll let him tell you the rest.
So, my name is Chad Stencel, and I'm a family nurse practitioner. And we are a primary care cash based service.
And so for people who are not familiar with how this all works, explain when you say primary care, what exactly do you mostly see people for?
Sure. Great question. We see people for pretty much anything in my clinic. So, a lot of my patients come in because I do some specialty stuff like ultrasound-guided joint injections for chronic pain, pharmacogenomics, so a test where I swab people's cheeks and it tells me how your body metabolizes medications, which is super important. But I also see the everyday things from, back pain, a sore throat, influenza, COVID infections, baby wellness visits, pretty much everything. Because I'm a family nurse practitioner, I see, young children all the way up through elderly.
That's really helpful. And I love that you have certain specialty things that you do that I feel like, and correct me if I'm wrong, you might not be able to do otherwise. The I don't know if I can say that. Pharmacogenetics. Did I say that right?
Yes, pharmacogenetics or pharmacogenomics, yeah, long word. It's something that I'm considered a local and almost a national expert on. It's a test that's been around for 20 some years, but yet there's not a lot of people that are trained in it, and there's not a lot of providers that wanna do it. Older doctors, a lot of them are very resistant to this, but this is where primary care or personalized medicine is moving.
Yeah, personalized medicine. I love that you name that. And I want to talk a little bit more about the pharmacogenomics. Sure, I get that word right. Because it is so unique and it's something that is new for people. They may have never heard of it or they've heard of it, but they don't know much about it.
Pharmacogenomics, the test has been around for 20 years. It was developed in Minnesota at Mayo Clinic. Nobody uses it, but people should start using it because lawyers are getting smarter. On average, there's 60,000 hospital admissions per year in the United States from an adverse drug reaction. That's not an allergic reaction. That's a reaction because they didn't metabolize the medication correctly. So I give a prescription for blood pressure to anybody. There are people that metabolize that medication super slow, so they'll get toxic on it. There are people that metabolize that medication super fast. They need a higher dose. It doesn't work. I can have a patient come into my office, swab their cheek, send that into a company that runs that test with a 2-day turnaround time. Very affordable, by the way. The test is 100% covered by insurance if you have a medical condition. Otherwise, the most a person would pay out of pocket is, I believe, $299. Most people pay 0 or $25. It's a one and done. You never have to get the test again. You get to own the information. The company doesn't own it. I don't own it. The patient owns their profile. You get a big profile of every category of medication that's out there, from antibiotics, chemo agents if you have cancer, pain medications, blood pressure medications, anesthesia medications, every set of medications. And it tells us specifically how you metabolize those medications.
I want to pause here for just a minute and ask the question. Have you ever heard of pharmacogenomics? I never had. I couldn't even say the word when we were doing this interview. I asked the question because it's something that's been around for over 20 years. Drop in the comments if you've heard of it before or if you've actually had the test. And if you haven't, keep watching and stay tuned to learn how you can learn more about it.
It also looks at an MTHFR gene mutation. If you have the MTHFR gene mutation, and about 70 or 80% of the population does have it, and only about 20% know they have it because no one's been tested for it. It's linked to ADD, ADHD, different types of cancer, neurological conditions, everything, and it's very easily treated. You treat it with methylated folic acid. It's $9 on Amazon for a 90-day supply. This test should be done on every single patient that comes into any clinic, any hospital, because we can upload it to the EHR. And when I prescribe a medication and your body doesn't metabolize it, it will pop up with a best practice advisory or some kind of flag and will say, pick a different medication or adjust the dose, lower dose, higher dose. The reason why I bring this up is it's personalized medicine. We are taking better care of our patients when we know how they metabolize medications. What I've seen recently is people coming in and saying, well, I have insurance. And the first question I ask them is, what's your out of pocket deductible? What do you have to pay before your insurance kicks in? And Susie, as of late, people are paying up to $25,000 before their insurance kicks in. And so then I tell them, I'm like, do you understand you could then see me for 100 visits or more if you pay me $250 for a visit? So we need to educate our patients that yes, you need insurance for the catastrophic things. If you need surgery, if you get injured, those types of things. But for a lot of other things, it's cheaper to come in and pay me my fee of $250 or whatever your fee is going to be than it is to pay that $25,000 deductible. And I've told patients that have gotten, upset or frustrated with that. I'm like, I could go get credentialed with insurances. I've been credentialed with all of the companies. But then if you come into my office, instead of a $250 visit, I'm going to charge you $2,000 because I know that insurance company is only going to reimburse me a certain percentage of that. Or until you hit your deductible, you're going to pay me $2,000 for the same visit you could have paid me $250 for. So a lot of education with patients. Some are resistant. Some are like, why haven't I been doing this forever? And a lot of patients are very open to paying the fee, especially when it comes to their health. It's the why, right? Because there could be 10 clinics in a row and they have to pick somebody. Tell them why they should come see you. Tell them that you're passionate about caring for people. You're going to spend extra time. You're going to go the extra mile. You do things that other people don't do. You know, one thing that I share with people, I have MS. So I'm going to really look at people with MS probably in a different light because I've been through the same things that they've gone through. And it took 7 years for me to get diagnosed, right? Because I kept going to doctors and they kept saying, oh, it's anxiety, it's depression. Oh, you have headaches. It wasn't until I saw a nurse practitioner that actually spent time with me that went, I think you have MS. And I had an MRI, and sure enough, I have lesions on my brain because that's why we got into this, is to care for people. I don't care about the money. Obviously, I need to make money to pay my bills and do things, but it's not why I got into healthcare. I got into healthcare to care for people and make people better.
If anything that Chad shared resonated with you, it's worth sitting with and thinking about personalized medicine. Pharmacogenomics has been around for over 20 years, and people aren't getting offered the test. If you're curious about this test, check with your practitioner and see if they offer the test to you or if they can refer you to a place where you can be tested. This is a one time test that you take, and it gives you a profile of how you metabolize different medications. This could be key to improving your health. So ask for it. Get curious. If you're in Minnesota, you can search for Chad Stencel in the Centered Care Directory at how.healthcare. You can also search by state if you type in or select Minnesota, and it will give you a list of the reviewed and approved practitioners that are in Minnesota. The directory is free to search, and if you're enjoying this channel, click the subscribe button, and we will see you in the next video.